Thank you. I'm very honored to be here today. Thanks to the Grace Organization and the MRA, not only for inviting me to be here, but for everything you do in the overall fight against cancer. This morning, we've heard, and later today we'll continue to hear great things about immunotherapy. Science, technology, strategy, how to administer it. But for someone with advanced stage disease, the only thing that matters is, does it work? So among all these incredibly intelligent, scholarly individuals that are here to give you the science, I'm here to give you the proof. 8 years ago, I was diagnosed with stage 4 melanoma. It started as a mole on my shoulder, very simple scenario, not uncommon in the melanoma world. And of course, I did the normal procedures. I totally freaked out. And then, of course, I got an oncologist and actually did the normal procedures where I had a wide area incision and sentinel node removal. As many people in this room know, there are very few things more paralyzing than hearing for the very first time that you've got cancer. The only other thing as paralyzing is waiting for test results every time we have scans. So while I was waiting a week to get sentinel node results, I had time to contemplate the rest of my life, or the rest of my life. One of those two contemplations was going to be much different than the other one. And when the results returned, it was not what I was hoping for. This was 8 years ago. There were not very many viable options for stage 4 melanoma, or any melanoma. I was told that the survival rate, the 5-year survival rate, were single digits. I was not given a lot of hope. So my journey began, and since then I've had 10 surgeries. Lymph node removal, 2 open skull brain surgeries, standard radiation on my elbow, my lung, my bicep. I had standard radiation, and I had gamma knife and cyber knife on my brain recurrences. That's why I couldn't remember gamma knife and cyber knife was probably the second brain surgery, is the one that I had FDA-approved drug IL-2 and Girovoy, and I did 2 clinical trials, one at the University of Virginia and one at the Moffitt Cancer Center in Tampa, Florida. At no point during this time did I go more than 9 months without a recurrence. Side effects were really taking their toll, not on my body, but also on my mind. So in the summer of 2012, I was out of options. My disease was becoming very aggressive. You know, I could always find a tumor here or there under the skin, but now they were sticking out of the skin. Not 1 or 2, but many. I was not able to work. I was very sick. The coincidences that have taken place during my 8-year journey would seriously take up all of my time this morning. So instead of telling you all the pieces of the puzzle that fell into place for me to get evaluated for clinical trial number 3 at Sloan Kettering, I'll just say a friend of a friend of a friend of a work associate knew someone. Again, I was sick. I'd been through 2 previous trials. I know they're very time-consuming. Sometimes the side effects are way debilitating. And I live in Virginia. I would have to travel to New York every 2 weeks. I wasn't sure this is what I wanted to do, but because I have an incredible support team with family and friends, they talked me into it, and it turns out it was a pretty good choice. In October of 2012, I received my first nivolumab infusion. And every 2 weeks after that, until July of this year, I traveled to the 4th floor Memorial Sloan Kettering for treatment. I know my doctors get a little uneasy when I say I actually felt the drug work the first day. And since a few of them are here, I'm going to skip that part. But I will say that my 6-week scans following the first infusion, the markers that we were tracking showed 23% reduction. I had volunteered to have one of the smaller tumors in my arm removed for further study. And as they were trying to find the time for the surgery, I said, "You should hurry or there won't be anything to remove." It was removed. The pathology came back, 100% necrotic melanoma cells. So I continued my bi-monthly journey to New York and my 6-week CT scans, and each one shown improvement. Follow-up scans from just a few weeks ago showed that the tracking markers are now 95% reduction. Never really know how to handle that because it's not me, you know. This is just a great drug that I was lucky enough to get. I did nothing but become very lucky. So many drugs, cancer drugs, have this debilitating side effects, and I've been through it more than once. But 6 weeks into nivolumab, I returned to work, and I've been back at work ever since. Now, I realize that I'm the exception to the rule. I'm one of the fortunate few. Not only because nivolumab is working for me, but because I ever got the chance to see. I'm incredibly grateful to the scientists, the doctors, researchers, Bristol Myers, specifically Dr. Walchuk and his incredible staff at Sloan Kettering. But I may never have gotten the chance to receive this game-changing drug if it were not for organizations like GRACE and the MRA. We put the latest technology into the patient's hands, and they put real research dollars into the right hands for research. Cancer is an evil disease, but with support from people like these and doctors like these, we're gaining on it. And I'm the proof. Thanks.